Have you ever wondered what would happen if you were bitten by 1 million ticks? A chilling thought, isn't it? But let's dive into this hypothetical scenario for a moment. First up, ticks. These tiny arachnids are known for their biting mechanism. Unlike a mosquito that pierces and sucks, ticks latch on, embedding their heads into their host's skin, and feast on blood at their leisure. Now, 1 or 2 ticks might be manageable, but what about 1 million? To truly grasp the scale of 1 million ticks, consider this. If we were to line them up, they would stretch for about 10 kilometers. That's roughly the distance of a standard fun run. And if all of these ticks decided to feast on you, they would cover almost every inch of your body. Imagine the sheer volume of 1 million ticks. Can you picture it? Now imagine them all biting you at once. A daunting prospect indeed. Let's delve deeper. So, what would happen immediately after these tiny creatures sink their teeth into your skin? Well, let's imagine the scene. You're standing there, 1 million microscopic jaws clamping down on your skin. As soon as these minuscule monsters pierce your skin, your body's defense mechanisms spring into action. Your immune system rushes to the scene of the invasion, causing the immediate area to become inflamed. This inflammation is your body's way of trying to isolate and neutralize the invader. It manifests as redness and swelling at the site of the bite, a telltale sign that something's not right. But it's not just about the visible signs. There's a sensory aspect to it as well. You might feel a prickle, a tingle, or even a sharp sting. This is your body's alarm system at work, alerting you to the fact that your skin's been breached. Now, remember, we're not talking about a single tick bite here. We're talking about 1 million. The combined effect of all these bites would be far more intense. Your skin would turn into a sea of red swollen spots, each one the epicenter of a tiny battlefield where your body's fighting off the tick's saliva. And let's not forget about the itching. Oh, the itching. It's your body's way of encouraging you to scratch and hopefully dislodge the intruders. But with 1 million ticks, the itching would be maddening, almost unbearable. And each scratch, each attempt to relieve the itch would only serve to further inflame the skin, exacerbating the redness and swelling. The pain, the discomfort, the incessant itch, the unsightly inflammation, it would all be overwhelming, to say the least. Your body, in its effort to defend itself, would essentially be under siege from these tiny invaders. The immediate physical impact is severe, but what about the long-term effects? What could possibly happen next? Could this scenario lead to lasting health complications? What are the risks involved? Let's dive deeper into the long-term health effects of 1 million tick bites. Ticks are more than just pesky parasites. They are carriers of various diseases, some of which can have severe, long-term implications on your health. 2 of the most commonly transmitted diseases are Lyme disease and Rocky Mountain spotted fever. Lyme disease, named after the town of Lyme, Connecticut, where it was first identified, is a bacterial infection that can cause a variety of symptoms. Early signs include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. If left untreated, the infection can spread to joints, the heart, and the nervous system, causing more severe symptoms like arthritis, heart palpitations, and neurological problems. On the other hand, Rocky Mountain spotted fever is a potentially life-threatening infection caused by the bacterium Rickettsia rickettsii. Initial symptoms often include high fever, severe headache, muscle pain, and a distinctive rash that appears a few days after the onset of symptoms. If not promptly treated, it can cause serious damage to internal organs such as the heart and kidneys. Now imagine the havoc these diseases could wreak if you were bitten by 1 million ticks. The sheer number of bites could exponentially increase the chances of disease transmission, leading to a myriad of symptoms, possibly even multiple infections at once. Treatment for these diseases typically involves antibiotics, with the type and duration of treatment depending on the specific disease and the patient's overall health. The good news is, if caught early, both Lyme disease and Rocky Mountain spotted fever can be effectively treated. However, in severe cases or if left untreated, these diseases can lead to long-term health complications. So 1 million tick bites could lead to severe health complications. But what if we could prevent this from happening? How can we protect ourselves from such a terrifying scenario? Are there ways to prevent tick bites? Indeed, there are preventive measures to keep these tiny terrors at bay. Using tick repellents is a good start. These are available in various forms: sprays, creams, or even wearable devices. They deter ticks from latching onto your skin, making you less of a tick buffet. Next, consider dressing appropriately, especially when venturing into tick-infested areas. Protective clothing, such as long-sleeved shirts and pants tucked into socks, can create a physical barrier against ticks. Light-colored clothing can also make it easier to spot these minute menace. After spending time outdoors, perform a thorough tick check. Inspect your clothing and body carefully, paying special attention to hidden areas like behind the knees, the armpits, and the scalp. If you do discover a tick, it's crucial to remove it correctly. Use tweezers to grasp the tick as close to the skin surface as possible and pull upward with steady, even pressure. This minimizes the risk of disease transmission. Protecting ourselves from ticks is crucial to avoid such a horrifying experience, but what if it's too late? What if you've already been bitten? What should you do if you've already been bitten by a tick? Is there a way to mitigate the damage? Well, the first step is to stay calm and remove the tick as soon as possible. Use fine-tipped tweezers to grasp the tick close to the skin's surface and then pull upward with steady, even pressure. Avoid twisting or jerking the tick, as this can cause the mouthparts to break off and remain in the skin. Once the tick is removed, thoroughly clean the bite area with soap and warm water. Over the next few weeks, keep an eye out for any unusual symptoms such as rash, fever, fatigue, or joint pain. These could be signs of a tick-borne disease and warrant immediate medical attention. So, while a million tick bites is a terrifying thought, knowing how to prevent and handle tick bites can help keep us safe. Remember, knowledge is power.
Don't forget to like, subscribe, and share this video. That's all for Nifty Narrations.